So we often get comments like this from pro-choice people and pro-life people asking us to discuss specific stories claiming women have been denied medical care because of abortion laws. To be frank, we don't discuss the stories that often because a lot of times they're anecdotes with very little verifiable information. So the Dobbs decision overturned Roe v. Wade, which has been around since 1973. And that means that legislatures across the country are trying to grapple with changes to a decades-long legal status quo. So it wouldn't surprise me if there are laws that are written too ambiguously or that imply things that they weren't meant to imply and that the language of those laws needs to be cleaned up. And to the extent that that's the case, then yes, we should of course fix it. The laws should be very clear and unambiguous, and they should all include strong exceptions for when the woman's life is in danger. However, a lot of these anecdotes claiming the laws have put women in danger don't make sense based on what the laws actually say, or even internally in the details of the articles themselves. So this comment mentions a Tennessean woman and a woman on TikTok. I believe this is the Tennessean woman. The woman went to the hospital and discovered that she had an ectopic pregnancy, and the article implies that they delayed care in a way that was in danger to her life in order to have lawyers review the situation and make sure that they would have an affirmative defense for performing what is considered an abortion. But if you read the article, a lot of that doesn't make any sense. First of all, every mention of the doctors involves them reassuring her that there is no problem and that they will be able to help her. The article implies that the doctors weren't able to help her as quickly as they needed to because they had to have a legal team review what was a legally complex situation. But the article also says that this hospital's legal team has been preparing for such situations since June, and the story took place in December. It also says that 1 to 2% of pregnancies are ectopic and that Tennessee would expect at minimum 780 ectopic pregnancies a year. This makes it seem improbable that the first time the hospital had to deal with treating an ectopic pregnancy was 6 months after the Dobbs decision. What actually happened is that the woman went to the hospital with an ectopic pregnancy, and then they assured her there was no problem legally with treating it, and then they treated it. I believe this is the TikTok woman the commenter refers to. Here the details are even harder to verify, but essentially the woman claimed on TikTok that she was having a miscarriage, that she wasn't getting treatment she needed for it. She implied that it was because of abortion laws in Idaho, and in at least one of the videos she said she was probably just going to bleed out on the table at the hospital because no one could or would help her. But once again, the article doesn't make a lot of sense. It discusses the abortion restrictions in Idaho, but it mentions that Oregon also wouldn't treat her. There are no gestational limits on abortion in Oregon, and Oregon's abortion laws have not changed since Dobbs. The article goes on to say that one doctor told the woman that her miscarriage was complete and there was nothing left to treat. And it's ambiguously written, but apparently later some other doctor or medical professional discovered that she had an ectopic pregnancy. And when they found out she had an ectopic pregnancy, they treated it in Idaho. Whatever issues were going on here, it doesn't sound like it had to do with the abortion law. It sounds like it had to do with confusion and miscommunication about what was actually happening with her. This is precisely why we don't normally spend a lot of time on every one of these stories. It takes time to try to find verifiable information. It takes time to explain why the story being portrayed isn't the whole story. And the result of these efforts is usually that you accuse us of not caring about women anyway.